Okay, is there a person with a microphone going around? No? Oh, wonderful, thank you. Okay, looks like it's working. I was most delighted with this wonderful set of presentations. And it's a great pleasure to see how far we've come. Because at GHEC for the last 19 to 20 years, we've been struggling. And suddenly there's a burst of activity in the last 10, 12 years. And with so many things on curricula, and let's share all the things between our colleagues, and commons license, and so on and so forth. And this is not only going at the student level, resident level, but it's also becoming at faculty level. Nobody says, this is my program, this is my site for which only my residents can go to Kenya or wherever else. We are beginning to learn what is called sharing of global health resources. And this bodes very well for the next century or so. Hopefully we'll all be alive then, or our kids will be, and they'll follow the same examples, and it'll be a peaceful place. Be as it may, I think you will all agree that the panel here did a fabulous job, and all the stuff that has been presented has taken months and months of thinking, collaborating, and going through the fine details, because all of you know, work on curricula, etc., and modules, readily understand how much work goes into that. So before we start our questions, I'd like to thank you all on behalf of myself and the audience. Okay, who's first, question-wise? Or are there no questions? The gentleman in the back and the lady here in the front, number 2. Please identify yourself.
Thank you for your presentations. I'm David from Oxford. Specifically, the question is offered for each of you because what we're looking at is intercultural mentoring as a change management process. Various models are acknowledged, like the Harvard Kolb model, or the Vygotsky Russian model, or the UK Egan model, which looks at different styles of change, mediation, skilled helper, and the learning activity that is situated. My question to you is, each of you identified various mechanisms and tools that have been helpful in different countries on engaging another culture, participating and exchanging. But was there a specific element? 2 of you mentioned mentoring, but was there a specific deliberate mentoring curriculum and not have it a passive curriculum? Because in the literature review that we've looked at, there hasn't been one generated yet. And that's my question to you.
Okay, who would like to take it? We'll start at Susan. You've written so much about curriculum. You want to take this?
Well, are you talking about mentoring for the U.S. trainees or overseas trainees?
In the literature review, I looked at 35 countries and their style of education, and they have participated in mentoring through, let's say, pediatrics will write in their journal, or a particular university will have a department that has a professor in a passive role, but not coordinating just as you have here with guidelines. And I ask that because we want to put one together through this consortium. Because each of you are on the edge of saying that that's a next step, but I just wanted to ask, have any of you all explored that yet? Does that make sense? Okay.
So can I just get clear? So you mean, is there a guide for the faculty or the people running the program which they should follow for mentoring the students in these programs?
Yes. Because there's such inconsistencies across the countries using different styles. Oh, and the idea was intercultural, so there's not cross-cultural, and so there isn't a reentry rejection by their own people when it's not appeared as good medicine brought to their heritage. Does that make sense? In 93, 94, that was very specific for the Indian community. I mean, that notion.
Yeah. Okay, who wants to take that?
I can you hear me up there?
Yes.
At iTech, we have clinical mentoring training programs that we use specifically for clinicians training other clinicians. And those, we have kind of, you know, the nuts and bolts in place. And then when we're implementing them in the different countries in which we will work with our colleagues in that country to modify them so that they make sense.
Taylor.
Yeah. In terms of the University of Namibia work that we've been doing, I mentioned the thesis workshop, supervising and mentoring training we did in week 1. The University of Washington faculty member who is most directly involved with that is sitting in the back row. And sorry, Amy, I don't want to put you on the spot. But do we have a formal guideline, or can you speak a little bit to this issue?
Well, I think it's a great question. And no, we haven't created such a manual. I think we're trying to model the behavior, but we have not written it down. That would be a good contribution.
Yeah.
Did everybody hear that?
I was just going to say, I think that's also an excellent idea that would have broad applications. In this particular 7-week program I spoke of, one of the big reasons it's so successful is that so many faculty and professionals, both in the United States and then also in the country where the 3 weeks are spent, are very closely involved with the students and spend a lot of time with them and talk not just about the material but about careers, because it's really all about expanding their idea of what they can do with their professional training and changing them that way. And then a lot of links are made. One of the reasons they bring in so many faculty, and these are people volunteering their times, their travel is paid, but volunteering their time, is to make those connections. So there'll be an ongoing mentorship, and out of this come graduate opportunities and come employment opportunities and all. That's why it's so successful. But there is no sort of official guide, and I think that's an excellent idea.
Sorry. For our residency program, and at least in our pathway, mentoring was obviously a very important part of it, and we've put a lot of thought. I don't think we haven't developed a guideline. It's actually something that Manish and I and a lot of other folks on our team have been thinking a lot of and developing, and a lot of it's formulated at least around what we call a learning contract that we develop with the residents. And I think the main thing is that the mentorship relationship be longitudinal. I think it was very important that they each have a mentor assigned, and that mentor's role would be to help them to find other mentors. I think it's a little semantics. We call them advisors or preceptors, but to help them expand their mentor network, and then to follow them through the course of their residency program and sometimes beyond. And when they're going to Kenya, we have Skype is essential. There's a lot of live mentoring going on when they are overseas. In terms of the cross-cultural mentorship, we are really working with the faculty at the University of Nairobi to help support their mentorship of the Kenyan pediatric residents particularly during their time that they're working with ours.
Anybody else on the panel want to make a comment?
I just wanted to add that the residency learning objectives include objectives related to professionalism and cross-cultural communication, and the objectives are not only used for content but also for evaluation.